If not a slice of the biggest pie, then which pie? The Arkansas capital to Amazon, never mind. A different sort of business and the rush for potential riches. But first, if confusion reigns in Washington, can it be avoided here? Arkansas Week, next.
Local broadcast of Arkansas Week is made possible in part by the award-winning Arkansas Democrat-Gazette, Arkansas's largest major newspaper, bringing you local, national, and international news since 1819. By the Arkansas Times, keeping you informed by covering people, events, and politics in Arkansas. By FM 89, KUAR in Little Rock, with in-depth news reporting, analysis, and discussion each weekday.
Hello again, everyone. Thanks very much for joining us for Arkansas Week. We'll get to our roundtable in just a moment. First, the interplay of governments, federal and state, in the delivery of health care in Arkansas. Our guest is former State Representative John Burris, who was an architect of the original private option system, which followed the Affordable Care Act, AKA Obamacare. Mr. Burris, thanks very much for coming in.
Yeah, thank you.
A full disclosure, transparency, Mr. Burris and his career now as a lobbyist, you do have healthcare clients
I do.
involved in the system. But as one who was present at the creation, what do you make of the situation now? We get mixed signals constantly from Washington.
We do. And it's a good example of why you can't rely on Washington to set the healthcare policy, because I think there's, no matter who's in charge, there's always going to be that type of ebb and flow or pendulum swing of whatever party's in charge, whatever president's in charge. And a lot of the confusion we have now is a result of flaws in ACA that the Obama administration effectively ignored, and see it, the CSR debate that's consumed us over the past couple of weeks is a good example. The law was flawed, so by kind of executive privilege, they allowed that subsidy to flow. Now the Trump administration has dropped the court challenge that that the Obama administration had started. So now that payment's cut off. Now there's confusion. There's going to be something like that probably every week until Congress actually passes something that fixes a lot of the problems that we're seeing.
Well, that's exactly where the president seems to have kicked it, is over to the Congress, and yet the latest attempt at a compromise version, Mr. Alexander and Ms. Murray, I believe. The administration can't seem to make up its mind whether it likes it or not. At last report, it didn't.
Right. Yeah, the president tries to set policy over Twitter, and it's not good for the states. It's not good for the consumer. It's not good for states. So, in Arkansas, Governor Hutchinson came out pretty strongly for the Graham-Cassidy bill that was presented about a month ago. And there might be debate over funding levels and things like that, but the principles of that bill I thought were very strong, and I think the governor was right to support it because of exactly what we're seeing now. Really, instead of letting Congress and a president change the policy on a weekly basis, Graham-Cassidy will simply send money to states in the form of a block grant and say, you design your program. And I think the governor's position on that bill was largely driven by unilateral action, executive action from the Obama administration that we saw, and now really the same thing with the Trump administration. And it just creates instability in the marketplace that hurts taxpayers, but most of all, consumers.
Well, should those subsidies, though, be for at least the near term? Should they be continued?
The CSR payments, I think
marketplace subsidy. Yeah.
Well, so I think people are going to be able to continue to get their subsidy to offset their premium, and that's based on an income level. The CSR payment was really on top of that helped mitigate the out-of-pocket exposure on the plans, and this gets really technical in a lot of ways, and as most healthcare discussions do. I think that the Trump administration's position, while I disagree with it, it's legitimate. He's basically saying we don't have the authority to continue the payments, and the court agreed with him. I mean, the court sided with the House Republicans when they ruled that the CSR payments were not legally allowed. So the Obama administration was challenging that in court. The Trump administration dropped the challenge. And no matter what you think, the court ruled. And Congress should act and fix the problem. And, President Trump.
The court gave them a little breathing room.
They did. I mean, but Trump administration basically said, Congress, you fix this. And I don't have any problem putting Congress on the spot. I would have not done it the way he did it. But again, it all just, you back away from the issue of the week. What the real answer is, from my opinion, is letting states design their health care plan and the federal government be a funder but not a policymaker, and let 50 states set their own health care policy, and let's see who's right.
Well, under Cassidy and also, the whole block grant notion, though, would you acknowledge that somebody's going to lose?
Not really. The federal government will get budget stability. The state governments get the ability to design a health care plan, and then they're responsible for the outcome. And it's a lot easier to unelect your state rep or your governor than it is to unelect your congressman. And so, I've had debates with friends over the past month or so over this concept, and at the end of the day, it really just boils down to whether or not you want the federal government to design the health care plan or the state government. And I believe the state government can do it better. And if they don't, they're held accountable much easier than the federal government. I don't think, and this gets rhetorical, and I know it sounds like a talking point, but one size does not fit all. And I don't think federal government should be setting, essential health benefits and subsidy levels and redetermination schedules and all these really nuanced things that out of Washington, D.C. really don't apply to Arkansas or maybe don't apply to another state. Let the states be responsible and let them pay the price if they do it wrong.
Well, in the process, though, of managing, does it really matter in terms of patient care? To what extent does it matter in terms of patient care and who has coverage, whether Washington designs it or Arkansas designs it? You're going to be dealing with less money, are you not?
It depends. So there's, as part of Graham-Cassidy specifically, if that's what we're talking about, that bill, there was an approach to a traditional Medicaid, which is, when you think of that, it's typically your age, blind, disabled, your nursing homes, your children, people like that. The discussion here around private option, Arkansas Works, is around the able-bodied working adult category. I think that the Graham-Cassidy approach there is very simple and should really be a no-brainer. When you get into the traditional Medicaid, that's where a lot of the criticism came from, because you see more reductions in payments to the states if you move to a block grant model. But at the same time, I said reductions, and that's even unfair, because anytime you're talking health care, reductions are typically just reduced growth. So instead of a 5% growth, maybe a 2% growth. It's still more money. Anytime you're arguing health care, people, you always look at the number and the cost, and what the healthcare math is always over 10 years and usually just less growth than an actual cut. And that was the same thing with Graham-Cassidy. It wasn't actually less money. It was than the baseline. It was just a reduced growth line.
We have to end it there. We're out of time. John Burris, thank you for coming in.
All right, thank you.
And we'll be back with a roundtable in a moment. Presto Changeo, we're here with a panel. Benji Hardy, an independent journalist, joins us. Also, Lance Turner, reporter and columnist for Arkansas Business, and Steve Brawner, a syndicated columnist and independent journalist. And thanks to everybody for coming in. Benji, let's start with you on health care. Where are we? Nobody seems to know with any certainty, and I guess that's...
Right, so there's been just tremendous confusion over the past week around these CSRs, these cost-sharing reductions, and if I could back up just a second and talk about what exactly that means in very broad terms. One of the things that the ACA did in stabilizing the individual marketplace, trying to make individual insurance more affordable for American consumers, is it set up sort of two different streams of funding to subsidize the cost of that insurance. One, which people are more familiar with, are premium tax credits, which go to consumers to help them bear the cost of premiums. And those are based on an income scale. So the closer you get to the poverty line, the larger, more generous subsidy you get. The closer you get to the 400% of poverty cutoff, then the smaller your subsidy gets. The other type of payment, these cost-sharing reductions, which are made to insurance carriers as former Representative Burris said a second ago, reduce the cost of out-of-pocket expenses for low-income consumers. And those are payments that are made directly to insurers. Well, the Trump administration cut off those cost-sharing reduction payments. And this week we saw Governor Hutchinson come out and tell reporters, really it was a message to, more than anyone, to legislators within his own party who might be concerned about reauthorizing the Arkansas Works program, saying that Arkansas Works would not face instability because of the Trump administration's decision to cut off those payments. And there was some real concern about that because since Arkansas Works, the hybrid model that Arkansas uses to give insurance to very low-income people, since that uses the private insurance markets, an increase in premiums on the private insurance market would increase the cost of Arkansas Works. But the governor says he's found a workaround to basically make sure that Arkansas Works is not going to be rendered unstable by that change.
Well, what's the workaround?
Well, the workaround is that Arkansas can reduce another stream of funding to the insurance carriers. So, and the reason premiums would rise is because if insurance carriers get less federal money from the cost-sharing reduction payments, then they're going to make that up somehow, and they're going to make it up by bumping up premiums. And premiums would rise for everybody. Now, for a lot of consumers on the marketplace, they're going to be insulated from some of those rises. But other consumers are not, and the governor noted that about 4,000 people in Arkansas are above that 400% cutoff, so they have no premium subsidy. And they're going to absorb the full pain of any premium increase that the carriers, will put into place. And we've looked at some of those preliminary rate increases that the insurance commissioners already approved. Before the Trump administration's announcement, you were looking at rate increases of 8 to 10% for 2018, and now you're looking at rate increases of something like 15 to 25%. So these are significant increases.
Yeah, the president waited until we taped our broadcast last Friday before he announced these things, and within hours, the insurance commissioner had approved.
Right. I mean, the carriers were lined up and ready to do this because this has been on the fence for a long time about whether the Trump administration would actually cut off the flow of money.
Yeah, and Lance, the business community presumably weeping, well, not weeping, but very nervous about what's going to happen.
Well, yeah, and as usual, it's, the hospitals are among the constituencies that are worried about this because they don't want to see a spike in the uninsured care. Anybody who loses insurance as a result of any of this jostling and then comes into their hospitals and can't afford health care, that's bad for them. And Arkansas has seen rates of uninsured fall significantly under these programs, and so it's been a big help to hospitals, and hospitals are happy to see that more people have insurance. So I know that was probably over the weekend between the Trump administration's announcement and then the Monday news conference with the governor. I know there was probably a lot of hospital people sitting around kind of wondering what this meant for them. And that was, but even to that question, that was sort of the overall message the governor had was Arkansas Works is going to be fine, everything is okay, 4,000 people are going to feel the brunt of this, and that's bad. But for the most part, everything's fine. We're feeling good going into the session. Don't anybody panic. And it was kind of in that. If you get into sort of pure political matters, that's another illustration of the challenge, I think, of Republican governors dealing with these plans. Republican governors who have to govern on a daily basis under whatever healthcare system their states have set up under the ACA, with a president who doesn't live under those kinds of realities, and the president has one way of delivering a message, and then governors like Governor Hutchinson have another responsibility in another way to sort of deal with the reality of what the message is. And so, you had the governor basically cleaning up for the Trump administration, kind of causing this panic. The governor had to come out and say, let's let's hold on for just a minute and be level-headed about this and look at what this really means.
Well, as Mr. Burris and I were discussing a second ago, a bipartisan effort, 2 members of the Senate had come up with a short-term, anyway, compromise, a 2-year keep the money flowing situation, which Mr. Trump said he liked, and then he said he didn't like. So, and we're taping this at mid-morning. I mean, so there's plenty of time until sundown. But can we look and see what's going to happen? Like, for example, the Arkansas delegation.
Well,
All of this in the middle of a budget.
there's really, the Arkansas delegation, you don't have anybody really front and center either way on this issue. Right now there's 12 Democratic co-sponsors, 12 Republican co-sponsors for that bill. Notably, the Speaker of the House is against it, Paul Ryan. Typically, so much happens at leadership level nowadays in Congress that you don't see the lower level representatives and senators making that big a stink either way. Senator Cotton has tended to take a more of an almost middle of the ground of the road approach on this, knowing that he represents a state that depends on this. His passion is more on foreign policy. So I think we just have to wait and see how it shakes out. There's a lot of conservatives who are not for this, and Congress hasn't proven that it can accomplish a lot this year. So we're still stuck not knowing what's going to happen.
Interestingly, the governor was very cordially showing some frustration with the Trump administration when he talked to reporters earlier this week.
Not for the first time.
Not for the first time, no. I mean, he said something along the lines of, it can't just be disruption, that just cutting off these payments without any plan for a replacement is going to spell disaster. And the governor was supportive of the Graham-Cassidy bill, which would have repealed Obamacare and set in place a more sort of state-centric scheme, and also slashed funding pretty heavily, or at least funding growth. But when it comes to some of these mixed signals and the back and forth, I mean, I think the governor and many governors are in a very tough position about how to manage, as you say, the fallout from the Trump administration. And then there's also the issue of the Arkansas Works waiver, which the governor submitted a plan earlier this year, which at the time he seemed very confident back in March that it was going to be approved by the feds, that would have impose work requirements moving forward for Arkansas Works, and just generally made the program more conservative, more to his liking. Well, now there's been no action on it, and the rollout plan for this is to have it implemented on January 1st. So, asked about that waiver, here we are, 2.5 months to January 1st. The governor said there's still no word on it, and he said he's still optimistic, but admitted that he's becoming rather anxious about the timeline.
Well, he also said, Mr. Hutchinson also said this past week to the state, but to the highway lobby especially, look, I know I gave you a little bit of general revenues a few months ago, but keep your hands off of it come January.
Yeah,
Steve?
And the Highway Commission and the Highway Department are trying to find extra money. In fact, $400 million extra money, which is almost double what they have now for highways. And there is a move in the commission and the department to try to perhaps have a voter-led initiative on next year's ballot to try to raise money for highways. Among the plans that they had, in fact 9 different scenarios, all of them included trying to take some general revenues take some tax dollars out of general revenues and put them to highways. All these would have to do with auto-related purchases, parts, new cars, used cars, whatever.
Tires. Yeah.
Anything like that. Well, the governor this week said you can't do that. And the Highway Commission is constitutionally independent. It doesn't have to do what the governor says, but it surely could use his support on this matter. So that was a kind of a punch in the gut for what they were trying to do. It doesn't mean that effort is dead, but they're having to rethink things. Meanwhile, they know that next year's ballot will include the measure that the business community really wants, which is tort reform. And they were counting, they could really use the support of the Chamber of Commerce and groups like that. And they're going to be distracted with tort reform. So it is possible that the Highway Commission and the Department of Transportation will wait and see if they can get anything passed by the legislature in 2019. But again, that's a long way away, and they need money now.
It's very difficult in doing the math to find $400 million without. I think a lot of commissioners think, and that's why they've gravitated toward this plan, it's very difficult to get to that number without taking some out of general revenue. And so a lot of those plans that they've had that Steve talks about incorporate that. There's also the matter of a survey that they conducted that shows that the survey respondents, about 2,000 people, majority of those were in favor of some sort of take out of general revenue to help fund roads. So I think while they've been thrown a loop by the governor, and they certainly know that they need the governor on board, I think there's just the hard math of the problem that is a reality that they can't look away from. And I think that plan is still something that could be out there that they may have to resurrect and look at again.
Well, they'd have to raise the gas tax by 28.4 cents a gallon to get to $400 million, and that's not going to happen. Mm-hmm. And there was, President Trump has mentioned a $1 trillion infrastructure investment program. That there's been no specifics about that. There had been a lot of talk about public-private partnerships paying for part of it, tolls, but the president in a meeting not too long ago said that he wasn't too keen on that idea. So at this point, they don't know where they're going to get the money, and to get on the ballot next year, time is running out.
Well, and even as they acknowledge that, the needs and the fiscal needs, they seemed also, the commissioners, reading published accounts, I wasn't at the meeting, they seem to acknowledge that the support or the opposition of a governor in terms of a fiscal approach was all but essential. And if Mr. Hutchinson or any other governor declares general revenues off limits, that's an exceptionally steep hurdle to climb.
He's a popular governor and has a lot of folks behind him and has used that power very well. And several of them sort of noted that you got to have the governor in your corner. It's good to have him. But again, math problem. So I don't know. Don't know what that means.
All right, moving on. There is a scramble to get a license, following the medical marijuana initiative, which passed, and also some confusion about who's going to handle the money, which financial institution would handle the money. Benji.
Well, as far as the financial institutions, I guess I'll just give a little bit of background on that. The reason why that's difficult is because it's still
illegal.
It's still illegal, right, federally, and financial institutions have to look at federal law when it comes to what money they handle. Despite assurances from the federal government that have sort of evolved over the past couple of decades that the feds are not going to go after states that have medical marijuana laws. At least we've seen, at least not yet. But banks have to be very conscious of running afoul of federal law in any way. So you've seen these weird legal workarounds in states that have implemented medical marijuana that allow for a sort of parallel credit universe to evolve.
Set up and backed by the state government in some cases, and I think that's a model ironically, that's a model I think that the Department of Finance Administration is sort of looking at as a backup plan. Arkansas businesses asked around all over the state for banks, and is anyone willing to step up and bank this industry? And no one has stepped up, and a lot of folks say they don't need it. Johnny Allison, George Macris, they're like, we're under enough federal scrutiny as it is to bring this in would it's a headache that we don't need. We have heard some whispers that there's at least one banking player that is going to step forward and do it, but we don't know who it is yet. And we're not then assured that they're actually going to do it. So it is a big problem. They do not want this to be an all-cash industry. You don't want suitcases of cash going back and forth in storage rooms and what have you. And so that's another big hurdle that this growing industry faces. But they've managed workarounds in other states, and so perhaps they can manage one here in Arkansas.
Yeah, and even as that is underway, the search for someone to handle the transactions or the cash, as it were, the scramble for rights to cultivation and to marketing continue apace.
Yeah, we had 228 applications for dispensaries and 95 applications for the cultivation facilities. These are going to be kind of culled through and then given to the Medical Marijuana Commission. These applications are 400 pages to 3,000 pages long. There were people waiting outside the DFA offices. They slept there overnight on the day before the filing and handed in more than 100 that day.
And out of 95 cultivation applications, there is a maximum of 5 that could be approved.
Right.
Correct. There's 5 licenses for cultivation that could be handed out.
So, yeah, scramble is correct.
And they have to redact all of those documents to get to the review to the point where they can be reviewed by the panel, so the panel is not swayed by any biases or whatever. So there's just a lot of logistics and a lot of just grunt paperwork, I believe, involved in getting all this stuff ready. And so they have extended, I think, the timeline for when they'll be able to start issuing some of these into the first part of next year, maybe even beyond that. So it's a big process, big job.
Anyone who camps out at the door of DF&A for any reason has either got A, a big problem, or B, sees big profits.
Yeah.
They're not selling iPhones at DF&A, that's for sure. But yes, it's they've got, people are trying for this. They want to be the stakeholders in this business, and they see a big upside to it. We'll see how it shakes out.
I mean, it's all very frustrating to patients who are wondering when this will become available, for that matter, because, I mean, you're looking at well into next year or late next year before, yeah.
Got to end it there. We're out of time. Guys, thanks to you for coming in. As always, thanks to you for watching, and we'll see you next week.
Local broadcast of Arkansas Week is made possible in part by the award-winning Arkansas Democrat-Gazette, Arkansas's largest major newspaper, bringing you local, national, and international news since 1819. By the Arkansas Times, keeping you informed by covering people, events, and politics in Arkansas. By FM 89, KUAR in Little Rock, with in-depth news reporting, analysis, and discussion each weekday.